Nice. Nice. And again. Good. Good. Hey everybody, it's Dr. Tyler at Sioux Chiropractic, and I'm here with Gracie today. Gracie's been coming in and she's been experiencing some back pain. We've been working on her the last few weeks. She's also going to be our new neighbor next to our office. Gracie's going to be opening up a new coffee shop here in January, and we're super excited. We will definitely frequent her business for that. And yeah, Gracie, kind of tell us a little bit about what brought you in and kind of how you've been feeling.
Yeah, I experienced some really bad lower back pain one day, and then with like some ice and stretching it kind of went down, but it was still bugging me. So yeah, I came in and we've just been slowly working that out.
And then kind of what activities were you doing leading up to the back pain?
Yeah, I've been working next door getting my coffee shop ready, so a lot of painting and sanding and just kind of repetitive movements that made it kind of stiff.
So we've been working on her. We've been doing a lot of functional assessment, chiropractic adjustments, soft tissue work, and then a lot of rehab, just working on her hinge pattern and getting her to use more of her hips rather than using her lower back over and over again while doing those repeated movements. So we're going to start today by just assessing her motion, and then we'll go through our motion palpation scan, and then we'll get you all stretched out and treated up and ready to get back after it. How many days until the big opening?
I'm hoping the second or third week of January, so like 3 to 4 weeks. Yeah.
3 to 4 weeks?
Yep.
And what's the name of the shop going to be?
The name is New Grounds.
New Grounds.
Yes.
So be on the lookout for New Grounds here in a few weeks. We're all super excited.
Yes.
All right, Gracie, let's watch you move. I'm going to have you face here and then feet together. We're going to check your neck first and just have you look left and right, okay?
Okay.
Go for it. Any stiffness either direction?
I would say a little bit more when I turn this direction.
When you turn that way?
Yep.
All right, now I'm going to have you face this wall, and we're going to do your neck while looking up and down. And tell me if you get any stiffness or pain with either direction, as high and as low as you can. Anything there?
A little bit down here when I'm looking down.
When looking down?
Yep.
Okay. Now we're going to have you touch your toes. We'll check full spine flexion with that. So go ahead and try to touch your toes. Yep. Any discomfort in the back or?
Just a little stiffness, but nothing bad.
Not too bad. And then now I want you to raise your hands overhead. Look up at your hands. You're going to arch backwards with your spine as far as you can. Any discomfort there?
Just a little bit in that low back.
A little bit in the lower back. Was it worse going backwards or forwards?
Maybe a little bit more backwards.
Backwards?
Yeah.
Do that one more time.
Okay.
And you'll see, go ahead. You can see on her, a lot of her pivot is right here. She's not getting a ton of extension through here. That's something you'll see on a lot of our patients. Go ahead and come back up. So it's important that we get that thoracic spine to move better with extension. But in today's world, we're all rounded. We're forward. We're on phones, computers. In your case, you're doing a lot of work out in front of you with sanding, painting, things like that. So it's just promoting more of that rounded posture. And then your lower back's kind of making up for the lack of extension here by going excessive, and that can really it can compress those joints and cause some of your pain. So now what we're going to do is just palpate spine. So I'm going to have you sit here on the end. We're going to start in the pelvis. I'm just going to feel the joints here. You let me know if you have any pain or tenderness, okay? So we'll be here. So sacred grounds. What?
New Grounds.
New Grounds, yeah. I had another person that was sacred in the name.
There is a sacred. I've seen that.
Is there?
Before. Yeah.
So you guys have just been overhauling this whole space since how many months, or has it been a couple months?
I think we got in there for the first time like the end of October.
End of October?
Yeah, it's been about 2 months now.
And just relax. You let your elbows rest. And then I'm just going to try to push here. And what would you say kind of your theme is?
Kind of like modern
Relax.
but cozy at the same time. So I've been saying like modern farmhouse but coffee shop version.
The modern farmhouse coffee shop version.
Yeah.
I like it.
Yep.
Warm and cozy, modern.
Yep.
I think it'll be a hit.
Yes.
What have you gotten your drinks kind of down yet on your menu or?
getting there. I've got like the espresso and stuff picked out, so just kind of like making more of the specialty flavors and stuff, working on the menu.
Nice.
Yeah.
And are you guys going to do food also?
Yes, we'll have some like baked goods and then like breakfast sandwiches and some lunch as well.
Nice.
Simpler lunches.
That'll be good. Is that a little sore up here?
Yeah, a little bit.
So Gracie was kind of telling me on Saturday she was doing a little more painting and kind of multiple levels, would you say?
Yeah.
And that kind of flared her lower back up a little bit, just with those repeated movements. But then she was also having a little bit of neck discomfort too, and we'll see that a lot with anyone doing that painting motion, because you're kind of reaching overhead or out in front of you all the time, and this cervical thoracic junction can get really, really tight and restricted. So that's what I'm noticing on her as I work my way up with my palpation. Not a lot of movement going on in that lower cervical and upper thoracic spine. So we're going to open that up. She's got a lot of tightness in the upper traps, and those muscles, they're actually a really big muscle. The trapezius starts at the base of the skull, goes all the way to the shoulders, kind of makes a diamond shape, goes all the way down here. But she's way more active up here, and that can be stemming or that can be coming up into the neck as well. And you get headaches at all with this?
Yeah, I had a really bad one this morning.
This morning, yeah. So like really tight through here, and it's palpable in the upper part of her neck, which that's the headache zone when these guys get overused. And so from a rehab standpoint, we'll try to activate her mid and lower traps a little bit more and work on her shoulder stability, and that'll help relax these. But on the hands-on portion of her treatment today, I'm going to stretch throughout here first, and then we'll do our manipulation at the end. So we'll do some release over these muscles. We'll work a little bit in that lower back region, do our manipulation, and then after she's done, she'll work with Eli out in the gym, and yeah, he'll take her through some of the different exercises we've been doing with her. So sound good?
Sounds good.
Awesome. All right, I'm gonna just stretch this area first.
Okay.
So you're gonna feel like a good hurt when I do it. If it's too much, let me know. But we're gonna start with we'll do one on each side. We're gonna shrug the shoulder, and then you're gonna reach down to the opposite hip, and then you're gonna look down to the opposite hip. You're gonna feel that kind of pull under my thumb. And is that okay?
Yep.
And we'll just keep doing that. And I'll kind of work my way up the muscle, and then we'll switch sides. And this is the upper trap levator scapula muscle, one of the most common things we treat in our office when it comes to the neck and upper back region, because these guys are just on all day long on most people, and we want to try to get that loosened up so her adjustment goes a little smoother, and we're not fighting through that muscle guarding the whole time. You okay?
Yep.
Good. There we go. And then we'll rotate away. And then new grounds, opening up mid-January.
Mm-hmm.
We started hiring yet?
Yes, I have.
Yeah?
Got some people lined up, and then some more potentials. So
What are some other things that you're excited about with the business, or that future customers have to look forward to?
yeah, I'm really excited about just being able to offer like good quality coffee, as well as just like having a really inviting atmosphere, just like really friendly, but also like a good place for people to get work and homework done.
Nice.
Especially for DORT students. I think that'll be really nice.
Yeah, I think DORT students are going to be super excited to have some more space to do that, and a fresh modern vibe.
Right.
And you're a DORT grad yourself.
I am, yes. I went for a 2-year business there.
Nice. We have a lot of DORT grads in our office, so it's, yeah, I know a lot of people, I mean, that parking lot was always, it was a busy place, especially during the school year, so it's going to be good for you.
Yes.
We're excited. We used to call that space the cafeteria because we would go there like once or twice a day to get our coffee fix or get a bite to eat. So, I'm just kind of working a little bit of her neck erectors and rotator muscles. Try and get those loose. That a little tender?
Yeah.
There we go. All right, Gracie, I'm going to have you lay on your back and we'll work that a little bit more. So some baked goods, do you have any like signature drinks or signature dishes that are in the works?
I'm gonna do real fruit smoothies, which I think will be good because I think a lot of people, like when they get a smoothie, they don't want it to just be like syrup.
Mm-hmm.
So I'm gonna do real fruit and then lotus drinks, and then yeah, just your typical espresso lattes and.
Talk me through the lotus drinks.
So that's like lotus is like an energy concentrate.
Mm-hmm.
So you do like some of that, and then it's club soda or like soda water.
Mm-hmm.
And then you can pretty much add any flavors that you want to it. So
you have some fun flavors of those?
yes, we'll do some like different combinations for people to try, and then yeah, you can kind of build your own too if you want.
That'd be cool.
Yes.
I like the real fruit smoothies.
Yeah.
I think the syrup stuff it's just not good. The more natural, the better.
Right.
Fresh ingredients.
Yep.
The syrup stuff tastes good, but never feel good after doing any of those. You have real strawberries or other fruits.
And we'll probably use like frozen fruits to stay good longer.
You bet. All right. While I got you here, I'm going to go ahead and adjust that neck first, if that's okay.
Yep.
So we're just going to be right on this C2, C3 vertebra. And we'll go right there. It's already going.
Yep.
Nice. And we'll be right about here on the right. Is that okay?
Mm-hmm.
And just relax. There you go. Nice. Then I'm going to have you scooch down a little bit more. And we're going to get that upper and middle back. And then I'll get you back upright. We'll stretch the lower back. And then we'll finish off adjusting that, okay?
Okay.
Go ahead and grab my hand and pull up. And then this is just going to go right behind you. You can lay right back down. We're going to kind of keep everything curled up here. Just like that. Okay. Tuck your head and neck. Take a deep breath. Let it out. And again. One more. And out. Good job. Back up. Perfect. Now you can slide down to the end, Gracie. And this time I want you to just cross your arms like you're hugging yourself. And I'm going to be in the lower back. And we're going to start by just bringing you back into the right and then rounding you down into the left. Feel a little pull.
Yep.
Keep going. There we go. So right now I'm working on Gracie's erector muscles. So those kind of go up and down the spine. So I'm trying to release those by bringing her back and rounding her forward, and she's feeling that pressure build up as I bring her through that motion. And then I'm going a little deeper on a muscle called the QL, or the quadratus lumborum. And that's one that we often see that gets super tight on folks, especially doing the kind of repetitive things that she's doing right now. It sits right on top of the iliac crest and kind of goes right below that bottom rib. And that can really be compressive in the lower back when that's super tight. So we're working both of those out with these motions. Good. That feeling okay?
Yeah. Feels good.
And then we'll come in this way and the other way. You bet. And again, and the other way. Awesome. Okay, so now we're going to go ahead and adjust that. I'm going to have you lay on this shoulder and hip first, facing me. We'll tuck that foot here and slide forward a little bit more. You got it. Right to here. All right, you just relax. I'm going to roll you into me, okay?
Okay.
And one more. Other way. Good job. Good. Then we'll recheck your motion and see how we're feeling. Okay. You're going to feel the table just lift up here. There we go. One more. Good job. How's that feel?
Feels good.
All right, I'm going to be right through this TL region, and this is close to the diaphragm, so it can kind of feel like it wants to take your breath away sometimes.
Okay.
To help with that, I want you to look straight ahead. You're going to lift your head up, take a deep breath, and hold it, okay?
Okay.
Deep breath, hold. Good. One more, and let it out. And then let your head drop. Good. Perfect. All right, come on up. Let's watch you move. So we'll do the neck first, facing her. I'm going to have you just look up, or left and right.
Okay.
Go ahead. How's that feel?
Feels good.
And then you can face that way, and then we'll look up and down. How's that feel looking down?
Yeah, it feels better looking down.
Yeah?
Yep.
Now try to touch your toes. How's that motion?
Good.
And then reach above your head, look up, arch back. How about there?
Yeah, feels good.
A little better?
Yeah.
Good. All right, so Gracie, thank you for letting
Yeah,
us work
no
on you and
problem.
show everybody what we do. We're really looking forward to new grounds
Yes.
opening up in January next door to our office. And if you like our content, you like our videos and what we're doing here, please hit the like and subscribe button. And we look forward to seeing you soon and wish you a Merry Christmas and Happy Holidays.